Hello and welcome to your lecture. In this recording, I wanted to cover some interesting parts of the central nervous system. As we've learned, central nervous system is brain and spine and all of their parts and all of their functions. So this time I wanted to get into functional brain systems, particularly the limbic system and the reticular formation. The limbic system, these are structures that are on the medial aspects of our cerebral hemispheres, as well as parts of our diencephalon. The fornix is a fiber tract within the brain that will link these regions together. Worthy of mention also that it will include cerebral structures that encircle the brain stem. The limbic system is a large part of our emotional response system. We have a portion of it called the amygdala, or the amygdaloid body. This part of the limbic system will recognize angry or fearful facial expressions, and it has the ability to assess dangerous situations and also then elicit a fear-based response accordingly. The amygdala has been known to play a large part in anxiety and PTSD. The cingulate gyrus, this portion of the limbic system, plays a role in expressing emotions via gestures and resolves mental conflicts within us. So if we're looking at a picture of this, this will be extremely helpful. Although a lot of these anatomical places within the brain, they don't have rigid boundaries of functionality, and so many of them connect with other parts in order for them all to work together in a very complex manner. So in this picture, we get to see, here's our sagittal section of the brain with our corpus callosum. Noted here, that's a very easy thing to see. But here, surrounding it, is the cingulate gyrus that we mentioned. So it's right in here. Here is the mammillary body, the hypothalamus. Then we have this circular structure that touches those points, connects to those points, and circles all the way around the diencephalon or the thalamus. That's the fornix, this red structure noted here that I'm pointing to with my pointer. Here then, at sort of a junction point to the fornix, we have the hippocampus, which will touch the amygdala. So the amygdala sits inferiorly to a lot of the brain structures, really. So the limbic system helps us with relating smells, certain smells, to emotions. So smell is a very emotional related sense, if that's going to make any sense. Most of the output is relayed via the hypothalamus. We saw that on our map in the previous picture. And it plays a role in a psychosomatic illness. The limbic system will interact with our prefrontal lobes, It helps us react emotionally to things we consciously understand and are aware of. Consciousness equals awareness. It makes us consciously aware of our emotions. So it's the point where we're able to sort of witness ourselves feeling an emotion. The hippocampus, which I pointed out, and the amygdala play a role in memory as well. Now, when we talk about the reticular formation, the reticular formation extends through the central core of the brainstem. It has 3 columns, the raphe nuclei, the medial group of the nuclei, and the lateral group of the nuclei. It will connect with the hypothalamus, the thalamus, the cerebral cortex, cerebellum, and spinal cord. So it allows or is a pathway to, we can say, brain arousal or alertness or stimulus. The reticular activating system. This is within the reticular formation. It's responsible for sending an impulse to the cerebral cortex to keep it conscious. It has the ability to filter out weak stimuli or repetitive stimuli. So 99% of all stimuli are not relayed to consciousness. So there's a lot of stuff our body is picking up. This is what this is saying. The reticular activating system has the ability to filter it out. So it's like when you become desensitized to certain things, you're just not aware. It'd be like wearing a watch. You're aware of it at first, and then after a while of wearing it, it's a stimuli that gets filtered out. The reticular activating system can be inhibited by our sleep centers, by alcohol, drugs, things that will impede or impair the process. This, if it gets damaged or injured, can result in coma. Motor function of reticular formation helps control our limb movements via reticulospinal tracts, and we'll see that language again. The reticular autonomic centers will regulate visceral motor functions. So this guy plays a large part in what your organ systems are doing within the visceral portion of your body. So vasomotor centers, meaning vessel control, your heart and your lungs. So here's a great picture of this system or center. And really, it's the thing that's everywhere and nowhere at the same time. So we might get some stimuli or sensory information that gets brought into the brain. The reticular activating neurons will relay the information to the cerebrum, but it has to go through the thalamus first. The continuous stream of stimuli will keep the cerebrum aroused and alert. So you can see if there's damage there, how almost everything shuts down. Just some review of major brain regions beyond limbic and reticular formation. Remember, cortical gray matter. This has the role of localizing and interpreting the sensory information, has the ability to control voluntary and skilled skeletal muscle activity, and also plays a role in intellect and emotions. The basal nuclei within the cerebrum or within the cerebral hemispheres, these are the subcortical motor centers. These will help skeletal muscle movements. When we get to the thalamus, this is sensory information that will relay it to the cortex for interpretation. Involved in memory and processing. The hypothalamus is the chief integration center of the autonomic nervous system, helps with body temperature, hunger, thirst, circadian rhythms, and drives. It regulates hormone output of the anterior portion of the pituitary gland. It does act as an endocrine organ because it produces the hormones that are stored within the posterior pituitary, and they are antidiuretic hormone and oxytocin. And then the limbic system, as we just went through. This will include the cerebral and diencephalon structures, including the hypothalamus and the anterior thalamic nuclei. It will mediate emotional responses and is involved in memory. The midbrain, remember, contains visual and auditory reflex centers. It contains subcortical motor centers like the substantia nigra and the red nuclei. It contains nuclei for cranial nerves 3 and 4 and contains projection fibers, which are fibers of the pyramidal tracts. The pons and the medulla. The pons is a relay center for the cerebrum and the cerebellum, cooperates with the medullary respiratory centers, contains the nuclei of cranial nerves 5 through 7. This contains projection fibers. The medulla, this will relay ascending sensory pathway impulses from the skin, proprioceptors through the nuclei. This will contain visceral nuclei controlling the heart rate, blood vessel diameter, respiratory rate, vomiting, coughing, etc. It relays sensory information to the cerebellum through the inferior olivary nuclei. It will contain the nuclei of cranial nerves 8 through 10 and 11. And 12. It's the site of decussation of the pyramids, and we pointed that out as we were walking through the anatomy of the central nervous system. Then there's the reticular formation, which we just went through. This maintains the cerebral cortical alertness and filters out repetitive stimuli. The cerebellum, responsible for balance and posture, processes information from the cerebral motor cortex, proprioceptors, and visual and equilibrium pathways. And it will provide instructions to the cerebral motor cortex and the subcortical motor centers. So when we talk about higher mental functions, we have to look at language, memory. We can talk about brain waves, EEGs, consciousness, sleep, and sleep-wake cycles. So 2 areas that we need to point out. Language, we have a language implementation system. The 2 main areas are Broca's area and Wernicke's area. Broca's area is involved in the production of speech. If we have a lesion in Broca's area, they might understand, but they can't speak. Whereas in Wernicke's area, this is the understanding. So patients with lesions in Wernicke's may be able to speak, but they won't make sense. So corresponding areas on the right side are involved with non-verbal language components. So in this picture, we can see a demonstration of Broca's area. And then more caudally in the brain, we have Wernicke's area. Broca's area again, is for ability to speak. Wernicke's area is the understanding or comprehension. When we talk about memory, this is storage and retrieval. There are different kinds of memory. There's declarative memory. This is names, faces, words, dates. Procedural memory, like playing a piano. Motor memory, like riding a bike. And emotional memory, linked to an emotion, the heart pounding when you hear a rattlesnake. There are two stages of declarative memory, short-term and long-term. Short-term, this is temporary holding of information, limited to 7 or 8 pieces of information at a time, whereas long-term memory is infinite and limitless. But we have factors that will affect the transfer of information from short-term to long-term. This is emotional state, how long you practice associating things or tying new information with old memories, and automatic memory, which is the subconscious storage of information, which gets stored anyway. It's being consciously aware of it. Memory consolidation involves fitting new facts into categories that are already stored. The hippocampus, temporal cortical areas, the thalamus, and the prefrontal cortex are involved in the consolidation of memory. So I think we're aware that this pathway can be interfered with at any point in time. If damage occurs in any of the brain centers that have to do with processing the information, we have potential lapse in memory. If we damage the hippocampus or the temporal lobe structures, we can have memory loss. If we have bilateral, this is amnesia. Anterograde amnesia, this is when consolidated memories get lost and new things are not associated with old stuff. Retrograde amnesia is the loss of memories formed in the distant past. When we talk about brainwaves, this is an exciting topic as well. I think so. We understand that we can measure the electrical patterns or activity of the brain. Normal brain functions are continuous and hard to measure. But we have found a way to at least toe dip into those pathways so that we can have a diagnostic tool, at least a place to start to be able to evaluate that. So EEG records will pick up electrical activity that accompany brain function. We can use this for diagnosing seizure disorders or sleep disorders. We can try to figure out where lesions or tumors or abscesses may be. And this is where you wear the cap and they put the gel on and they have the gel touch an electrode to pick up the brainwave activity. And this is what it looks like. So anyone that's had seizure activity, they might want to look for it. However, according to my understanding, if you don't catch a seizure within a particular time frame or window, you miss the opportunity. So each person's brainwave will be different. Patterns will change with age, stimulus, brain disease, and chemical state. We measure it in hertz. That's the unit of measure. And we have noticed alpha brainwaves, beta, theta, or delta, and each one tells us something different about a brain. So alpha waves between 8 and 13 hertz, they're regular and rhythmic, low amplitude, they're synchronous, indicating an idling brain. One thing about brain waves, it is what your brain produces. Also, we can correlate brain waves with the presence or absence of particular neurotransmitters. Also, you can listen to a particular sound and have a particular brainwave state inspired. For example, you can listen to theta brainwave music at a particular hertz or frequency, and then your brain will begin to resonate with that sound or with that frequency. Thereby, if you can get your brain into a particular brainwave state, you can also assist in the production of particular neurotransmitters and vice versa. Beta waves, these are rhythmic, less regular, occurring when mentally alert. And theta waves, these are more irregular, common in children and uncommon in awake adults. Theta waves are the waves when you're in a meditative state, or sort of that you're floating into sleep, but you're not quite sleeping. Delta waves, this is REM sleep waves. Also, I don't think mentioned here, no, they didn't mention gamma. We want gamma waves can be maybe therapeutic for dementia if we can instill them within a brain. The brain wave itself might be helpful. So when we talk epilepsy, then this is electrical discharges by a group of neurons. They prevent other messages from getting through. It's really like misfires, lots of them. They may lose consciousness. They fall stiffly and have uncontrollable jerking body movements. This isn't only epilepsy. This would be a grand mal seizure created by any of them, but there's definitely like an episode of the neurons misfiring. Epilepsy occurs in 1% of the population. Epigenetics is part of it, but other things like stroke, infections, tumors, hyperglycemia, hypoglycemia. An aura, when we're talking about this, it's a sensory, it says hallucination. I wouldn't call it that, but it may precede a seizure. Like you're going to have an awareness that something's not right. You feel a little off. An absence seizure, they used to call them petit mal. This is where someone just exits, blank stare. Nothing can happen. A tonic-clonic seizure, formerly called a grand mal seizure. This is most severe, lasts a few minutes. The person totally exits their body consciousness-wise, but they can be intense, and it's body flailing. They can lose bowel and bladder control, or they might bite their tongue. Their airway may be compromised. All kinds of things can happen while in this. Usually, they give anticonvulsive drugs to manage this. A vagus nerve stimulator or deep brain stimulator can be implanted to help stabilize the brain activity. When we talk consciousness, I use this word a lot, but in a different context. But there are similarities. This is a perception to sensation. It's being awake, it's being aware. Voluntary initiation and controlled movement. The capabilities are associated with higher mental processing, memory, logic, judgment. Again, alertness, awake, awareness. Consciousness involves an activity of our cortex, a lot of it. So it's holistic. It's a holistic viewpoint of how the brain works. It's like, again, it's having awareness of a lot all at one time. It's almost watching yourself go through, like when we were talking, the limbic system, having an awareness of your emotions. So almost being able to watch your emotions, kind of. Some words that you might be familiar with: fainting or syncope is a brief loss of consciousness, usually due to inadequate cerebral blood flow. So what's your body do? It kind of lays you down horizontally, making it easier for the brain to get blood. It's probably due to low blood pressure or ischemia. Coma, this is an unconsciousness for a long period. When we talk brain dead, this is an irreversible coma, which you would require life support for if there isn't something doing your breathing for you. This would be brain dead. So when we talk sleep and wake cycles, we have two types of sleep: non-rapid eye movement and then rapid eye movement. Our cortical activity gets suppressed or depressed. And this is a partial state of unconsciousness. So non-REM, this is the first 30 to 45 minutes of sleep. It's referred to as slow wave sleep. At about 90 minutes, the fourth stage will end and then REM will begin. Then there's temporary paralysis here, except for the eye movements. Oxygen consumption, heart rate, and breathing will increase, and the increase can be greater than when awake. Most dreams happen in REM. I think we probably know that. Here's a nice chart of walking through REM sleep and the stages. And when we see some of the wave activity. So in stage 1 of non-REM, this is alpha wave, will be higher. When we get down into stage 3, theta and delta waves begin to appear. And then non-REM stage 4, this is predominated by delta, as is REM. So we still have a lot to learn about sleep and sleep regulation. But a circadian rhythm, we're aware of that. That's our 24-hour cycle. So the reticular activating system has a hand in this. Its activity is inhibited during sleep, so it helps mediate or regulate the stages and cycle. The suprachiasmatic and preoptic nuclei of the hypothalamus time the sleep cycle. So the hypothalamus will release orexins that help the cortex to wake up. The typical sleep pattern will alternate between REM and non-REM. So here is a nice graph of a typical, we could say average adult through one's night sleep stages. Clearly, this is not the same for everyone. We think at this point that non-REM stages 3 and 4 are the most restorative, and that people that are deprived from REM become moody and depressed. The REM sleep gives the brain an opportunity to analyze the events of the day and to actually process emotional events and problems. It also, we think, eliminates unneeded synapses that may have been formed. So maybe we dream so that we can forget or dream it away or process it out or kind of splice it out of the recording. Sleep requirements will decline with age. Stage 4 sleep will decline steadily and may disappear after age 60. I will say that, not everyone needs the same amount of sleep. Some people do better on less than 8 hours, some more. It depends on the person and what's going on within them biochemically and large hormone contribution in it. Some disorders when we talk about sleep: narcolepsy, cataplexy, orexins. Orexins are wake up hormones. Insomnia may be treated by blocking orexin action, but it may be caused by depression or anxiety or caffeine or other stimulus, computer, cell phone use. Now, we already walked through the meninges in one of our other lectures. So I'm not going to repeat that information. We mentioned some of the degenerative brain disorders, one being Alzheimer's disease, under the umbrella of dementia, memory loss, short-term attention span, confusion, hallucinations are a big one we didn't talk about. It is a buildup to our understanding right now of what's called a beta amyloid protein or peptide formed in the brain. And it interferes with transport mechanisms, which will eventually kill the neuron. And the brain cells shrink and the brain shrinks. When we talked about Parkinson's disease, again, this is a degeneration of dopamine releasing neurons of the substantia nigra. The cause is unknown, but theories include mitochondrial abnormalities or protein degradation pathways. There's a lot more coming out about mitochondrial diseases and issues. Okay, that's enough for this information, and we'll see you on the next one.